World Hepatitis Day gi thoram Directorate of Health Services Manipur National Viral Hepatitis Control Program amadi National Health Mission na punna sinduna Imphal East ki Porampata leiba Jenims ki main auditorium da phongdokhre. Thoram aduda Health Minister Dr.S.Ranjan, Health Services ki Director Dr. Khoiram Sasi Kumar, Manipur State AIDS Control Society ki Project Director Haubam Rosita Devi amadi Jenims ki Director L Debena Maru oiba Mithunglen Singh oina saruk yaki. Thoram ki saruk ama oina laina asina narubadaki pharaklaba miyoi singna laina asina danaba jaksin thorak laubagi amadi naraklaba matungda kari tawgani haiba makhoi gi oiba experiencing miyamda phongdokhe. Chief guest oikiba Health Minister Dr.S.Ranjan na phongdokhibada hauzik Manipur gi mafam ayambada inkhalakliba chahi 15 dagi hauraga 15 fawgi manungda leiba naha ayambana drug sida laichubagi mami ama tarakle. Masi yamna mi painingai ni hiram asida mama mapa oiba singna maja singbu ningthina jaksina yengsinba mathau tari amaromda drug kapada syringe punna sisinabagi achauba akiba amasu lakle. Masigi awareness wat para haibagi chingna basulai Manipur gi Tungi yumbi oirakkadaba nahasing asi kannaba gi pandamda Manipur gi Chief Minister N Biren gi makhada war on drug yamna kanna changsile masil lenga khakta da sinabagi mahuta miyam punna jangsin minaba matam yaure haiki.
Ako gi Manipur gi huzik ki HIV AIDS matam mamada HIV AIDS hepatitis yamna urban centric bagi maung amalerami, but now it has gone right up to like amna kogi rural areas sida lekai da regardless of the geographical locations is range of sala brain khale jaga khudingmakna ni sigi sida kamaina. The most common is the sharing of syringes. I am a project director syringe share to biganu over the counter syringe han bagi matang syringe free the pitopagi matang do the syringe ke awareness among matam do layam ra. But now another generation, those young boys and girls sahi trauma dagina sahi kun mga gi marag sida sige importance awareness e khangda bagira moise drugs, injectable form of drugs, it's a fact. It's a